everybody, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we are going to be talking about the drug class aminoglycosides. Let's break it down. To start us off, what is this classification of drugs used for? So aminoglycosides are antibiotics. A couple examples that fall under this drug classification are tropomycin, gentamicin, and neomycin. You might already see the pattern here. So drugs that fall under this classification are going to end in mycin. There's a slight spelling difference. Some of them will have a Y or an I, but they still make the same sound. Also, please note that the drug classification itself does not end in mycin, so it's going to be something you have to remember. So, drugs that fall under this classification, mycin with a Y or an I. Something I want you to look for. Do not confuse mycin with thromycin. So, for some drugs, you might see an ending of THRO, mycin. These are totally different than mycin. So, thromycins actually fall under the classification of macrolides, whereas regular mycin falls under aminoglycoside. So when you're taking your exam, please read carefully, does the drug have a thromycin or just a mycin? Because it's two different classifications, so read carefully. Aminoglycosides can be used for a variety of things, including gram-positive bacteria, gram-negative bacteria, and ophthalmic, which are eye diseases. They can be administered in a multitude of ways, including IV administration as well as topical administration. As with all medications, and depending on the patient, we might have some effects that we are not looking for. Two examples are nephrotoxicity, so when we see nephro, think kidneys. And then we also might see some ototoxicity, so oto meaning ears. And with that, we might have tinnitus, which means ringing of the ears. I hope you guys learned something about the drug classification of aminoglycosides. Come back to my page to learn more.